This is Dr. Glick, and we'll be reviewing how to use and wear the home sleep test. First, empty the contents of the home sleep test bag and locate the nasal cannula. Connect this by screwing clockwise into the connector on the home sleep test unit. Next, place the belt around your body. Check that the belt is secure and comfortable and that the device is positioned over the center of your body. To avoid irritation or allergic reactions, wear the belt and device over a long-sleeved shirt. Next, place the oximeter sensor over your finger. The cord will be on the fingernail side of your finger. If the finger sensor is uncomfortable, you can move it to a different finger or your other hand. Clip the sensor box on the belt to the same side that the finger probe is on. Next, place the nasal cannulas into your nose. The curved side of the cannulas should be pointing towards the back of your nose. After the prongs are in your nostrils, loop the plastic tubing around your ears. Pull the slider up towards your chin until it feels secure. After your sleep test device is on, it is a good idea to use the adhesive tape to ensure a good reading. Apply 2 pieces of tape to your cheeks and 1 piece of tape to your hand. When you are ready to sleep, press the middle button down for 3 seconds to start the test. All 3 lights should turn green to show elements are recording properly. If during the night the lights turn red, please ensure all elements are situated properly on your body. Should you have any additional questions, please see our other videos on YouTube, information on our website at www.spiradental.com, or please contact our office.